Um, One question we have now, is it common for side effects to get worse the longer you are on the treatment? This is someone in the audience here today.
Well, I think the side effects are not related actually to the length of treatment. There are some patients who experience side effects immediately after starting a medication. And so this means that the medication is not the right one for them. And so we are going to try to switch to other option. And there are patients who actually develop the side effect after a long time that they have been on a treatment. So it's not actually related to the length of the treatment. Obviously, there are some side effects like allergic reaction that might develop soon after start the treatment, and then you have to stop the drug. But I mean, other side effects that can just develop after a few months or even year that you are taking the drug.
I think methotrexate, I don't know if the question was specifically regarding methotrexate. Yeah, so it's different to the other medicines. And so there is something about methotrexate, as amazing as it is, and I will like repeatedly say methotrexate has literally transformed patients' lives. And if you speak to, I'm sorry to repeat myself, but if you speak to the people who trained us, so sort of 2 generations back, they would say that the hardest thing about getting to our clinic rooms at Great Ormond Street was getting past all the guide dogs and the white sticks. And there are no guide dogs and no white sticks anymore, and that is mostly due to methotrexate. And so it is a completely amazing drug, but it is also a drug which makes loads of people really unwell and loads of people nauseous, and people don't like it. And it's our job now to be able to support you through that process and away from that drug if it's not the drug for you. And again, historically, we just had to deal with it because it was the only drug we had. Some people, when they start on methotrexate, are fine, and they're fine for the first few weeks, first few months, and then at some point, they start getting really sick and really nauseous from it. And in some people, that happens a decade after they've been taking it, and some people, it happens a few months after they've been taking it. And I think my message really is that just communicate it to us so that we can help you. And if it's the wrong medication for your child, then we'll do something about it. We're not going to force you to stay on the medicine. And that's, we're never going to force you to do anything. It's really about giving you the options. But we would very much recognize that pattern if that's what you're experiencing.